Now we're going to have this really amazing group of tech business health journalists. I'm always talking about tech journalists. They're health journalists, but they know a lot about tech. So would they please join me on stage? And we will continue with several of the themes we've touched on already. I sit in this chair. I will introduce them when they get up here. But they are a diverse but quite impressive crowd. Dan Monroe is a columnist at Forbes. He's written a book called Casino Healthcare, which is really a striking condemnation of the American healthcare system and a very passionate argument for a universal coverage without single payer, which is a really interesting distinction that most people don't even realize you can make, but he spent his whole book explaining why that's what the US needs, and I'm sure he'll get to some of those points as we go forward. Next to him, Brian Casey is someone you probably, many of you read. He's the editor of AuntMinnie.com, which is a radiology publication that covers everything from changes in the industry to treatment developments, so what doctors actually do. So he really knows about radiology, unlike the rest of us up here. I mean, Merrill, who probably does know a lot about radiology because he knows about everything in medicine because he's the editor of Modern Healthcare, probably knows the second most, but Brian is a serious expert on radiology. Merrill oversees 27 journalists, and you have a print publication as well as online, right? So you're like us, you still believe in print, which I applaud.
The only weekly news magazine in the healthcare space.
Is that right? Wow, that's very cool. So I'm sure many people here know that well. I want to start with you though, Brian, and feel free, any of you, to make comments or criticisms or jokes about anything you've heard on stage so far. But when we talk about the Facebook effect or social media's impact on radiology, what does that bring to mind for you in terms of where radiology is today and where it needs to go, or where radiologists want it to go?
I think that Facebook and other social media tools are, for radiology, a potential solution to a dynamic that's developed over the last couple decades in which radiology has kind of gotten more isolated from the rest of the healthcare team and from patients. And people in radiology and referring physicians kind of miss the days when the radiologist was the physician's physician. And I think there's a feeling now among radiologists of isolation. There's a feeling of separation. And I think in radiology, they see social media, Facebook, Twitter, things like that, as a way to kind of get back some of that interaction that maybe they used to have with patients and with referring physicians. And so you're seeing a lot of radiologists look for different sort of tools to kind of get some of that back.
So would you say that, in your opinion, radiologists want to interact more directly with patients?
I think
and this
so.
is a real way to do it?
Yeah, I think that they definitely, I mean, I can't speak for all radiologists, but I think in general, as a discipline, radiology understands that it needs to become more patient-facing. And
does the rest of medicine understand that?
Do they understand
that the radiologists want that?
Do the rest of medicine understand that radiology wants that? I'm not sure they do. I mean, that's a really good question. I'm not sure that they do.
Don't hesitate to tweet things if you want, because I might be able to see them. So, okay.
I think that there's a countervailing force within the healthcare system, which is that throughout the healthcare system, we're driving to more coordinated care. Social media is just a communications platform, and we're looking for all kinds of new types of communication platforms. So I think within healthcare, to the extent that radiologists are feeling like they're outside of the system, I think social media, as well as the electronic health record, as well as email communication, and even the internet inside a healthcare system is going to enable a lot more communication. And there is a big drive for care coordination. I think, though, on the other part of what you were saying, which is that is it going to facilitate greater interaction with the patient, I think that that's going to be a difficult lift for, I think, one overriding reason, and it has to do with something you talked about a little bit earlier, which is that the shifting environment we're in right now, which is a political environment. The politics of healthcare is changing dramatically. And if there's one overriding theme I think we're going to see over the next number of years, is that patients—
You mean 4 years?
At least. We're going to see patients have more skin in the game. There's no other way to describe it other than that phrase that a lot of people use. We could talk for a long time about what the impact that's going to be on healthcare, but what it's really going to mean in terms of social media is that patients are going to be using the internet, they're going to be using referrals to their friends, talking to people to find out how much did it cost, how much do I got to pay, and where can I go to get that done. And I think that that's going to be a huge driving force in the years ahead.
I think that's definitely true, and I think that social media can be a way for patients to gather some of that information that it's almost incumbent on them now to get. For example, when should I get a mammogram? When should I get a colonoscopy screening? When should am I eligible for CT lung cancer screening? Is there a less interventional procedure other than open surgery for my condition? And a lot of times their healthcare provider isn't telling them about all their options.
Yeah.
And so I think that social media is a way that radiologists can maybe try to participate in some of what you're talking about and educate patients a little bit about their options.
Social media is not even always the right term. I mean, to some extent, it's just communication pathways, right? I mean, I have a terrible experience I had with my doctor. Finally, I'm a tech guy, so I was always waiting to interact with my doctor digitally, right? And never did. I know that the doctor's been my doctor for like 30 years. I love the guy. But he finally sent me an email saying, we're creating this new digital way to interact, and please register here. And I had to go through this multi-stage process to like get into some kind of interaction with him. And then the first message he sends me is, I'm closing my practice. That is actually what happened. And I was pretty pissed off about it.
Well, imagine how long it would have taken you to find out about that if you didn't have...
I guess what I'm saying in telling that story is, in general, the patients, meaning people like me and all of us in that part of our lives, are pretty skeptical that the medical establishment in general understands our desire for interaction. It's not just in radiology. I don't think people feel like doctors really want to hear from them in general. You're nodding.
Yeah, so part of what we have to be careful about is talking about social media in a general category when in fact there's three different versions of it. There's the consumer-facing side of social media, which we're all familiar with: Facebook, Twitter, Instagram, Snapchat. There's the private social media networks that most consumers haven't even heard about in the clinical space, which are Sermo and Doximity. And those are very powerful tools within the healthcare industry that most consumers are completely unaware of.
What are they? Just quickly.
They're networks, in effect, that are like communication networks, but they're private to the providers, principally. And they've grown to their own scale in much the same way that Twitter and Facebook and Instagram have, not to that scope, but for the provider community. They're very specific networks that allow them to go in and collaborate on patient care amongst themselves in a real-time way that says, for example, if you have a challenging case, you can put an image up in this private network securely and get a diagnosis from somebody in another world, in another country, that would be helpful to
You mean a cheaper
treatment.
Doctor? Or?
In some ways, sure.
Well, another great one is Figure One.
Figure One is another example.
It's an app that enables radiology, bigger than just radiology, healthcare professionals in general to reach out and consult with other physicians in a way where the patient data is anonymized.
Can I ask, wait, how many people in this room use things like that? Really? Not that? Do I see only 3 hands in the whole room?
Wow.
That's not too many. Okay, so these are not commonly used tools. Okay, keep going.
So yeah, the third example is the one that I highlighted in an article about 2 years ago, which is BCSM, Breast Cancer Social Media Hashtag, which is a group that formed online on Twitter, and they meet weekly for the breast cancer category within healthcare. And this is also consumer facing, in the sense that anybody can join the tweet chat on a weekly basis. But the community that's grown up around it has a clinical focus and has patient experiences that are invaluable to share in a way that is protected and in a way that's comfortable for consumers to do that generally. So we have three distinct segments of social media that I think we need to be sensitive to. The broad ones that are the most familiar, and then we also use social media as code for technology disruption.
That's true. But I want to ask you something to sort of interweave multiple themes that we have already on this stage. Given that you are sort of the diagnostician of the healthcare ecosystem, right?
Okay.
When you heard Franz say before that he didn't think that the political changes would really get in the way of the steamroller of, efficiency and inevitable digital coolness, did you agree with that?
So I think from the vantage point of Philips, and certainly being a global company, they have a global footprint that gives them a slightly different perspective. Here in the US, I think we can expect and should expect some real challenges on the road ahead, in particular as it relates to Obamacare, the Affordable Care Act, and what we can and what we may expect to see on the road ahead, which is a big unknown. And that's sort of what's looming out there, is kind of a big question mark on what we can expect on the legislative side of healthcare, which represents the partnership that has to exist for all healthcare systems worldwide. It's a public-private partnership for every industrialized country, and that's no different than here in the US.
So basically the general idea of partnership across domains, you're sort of saying, and I mean, I would totally buy this, by the way, if this is what you're saying, that conceptual approach in general is not going to be as hot in the next 4 years as it's been?
It will be, we will test the limits of what we have seen in the past.
Fascinating. Okay. I'm going to jump over to Meryl on a related question, since just today we heard who Trump's nominee for the HHS secretary is, and also for that other agency. What is it?
CMS.
CMS, right. Yeah. Those are big announcements. When you hear that, what is your feeling about what that says about the potential to keep moving in the kind of very enlightened direction that this stage has been talking about for the last half hour?
Well, I'm in the Yogi Berra school when it comes to the future. It's pretty hard to predict. But I think that if you take Tom Price, a doctor, an orthopedic surgeon from Georgia, he is
currently a congressman, yeah.
Currently a congressman. I mean, he wants to rip up the Affordable Care Act.
He literally did rip up the Affordable Care Act.
Yeah, he literally did.
Yeah.
But when he talks about doing that, he's really almost only focusing on the insurance expansion side of it.
Right.
On the delivery system, everybody forgets that half of that law was about the delivery system reform and the push to more cost-effective care and more coordinated care. And in many of his statements, he's written letters even in recent weeks saying, hey, let's go slow on many of these mandatory demonstration projects, like the bundled payments program. So I'm hearing a mixed message. On the one hand, we know that people want to continue moving down the path to more affordable care, to more cost-effective care. And on the other hand, some of the more aggressive steps by the Obama administration to push in that direction, they're saying, let's draw a line and let's not go there. So it's I'm getting a mixed message there. If you look on the other side, Seema Verma, who quite frankly, who follow healthcare quite closely, didn't even know her name before late last night.
So she's a major national figure, yes.
But she's from Indiana and she ran the Medicaid program. Well, what did Mike Pence put in Indiana? He made people on Medicaid, who are, after all, the poorest people in our society, that's why you end up on Medicaid, he said, you're going to have skin in the game, going back to that other phrase I used. That's even if it's only a couple of dollars. Well, the one thing we know about giving people skin in the game is they're going to start making decisions based on their economic choices. In other words, if I don't want to pay it, I will postpone care. And we have seen this play out years and years of, over many, many years, many, many studies have looked at that. People will cut back on care when they have more skin on the game. We know from a lot of other studies that there's a lot of waste in healthcare. At the same time, we know from the studies that have looked at people who have economic skin in the game that when people cut back, they don't have any real good basis. With all due respect to the idea of the empowered patient, you have to become very, very empowered to know what are the right things to cut back on and what are the right things to make sure that you pay for, because those are the right things to do. And most people don't have good basis of information or the, quite frankly, skills to use social media or whether it's the internet or anything to get that information. Yeah. So she wants to move aggressively in that direction. I presume with Medicaid, they're going to push for Medicaid block grants. Again, that's going to give more people skin in the game, states more control of that program. He is saying sort of go slow on some aspects of payment
But you said he
reform.
also did support that bill you mentioned when we were talking earlier.
Well, he voted for MACRA, which is the Medicare Access and Chip Reauthorization Act, which is going to redo physician pay. All the radiologists in this room are very familiar with that because everybody's going to be put on this system. But even under the Obama administration, they've scaled back some of that. They've created a lot of loopholes for which people can sort of pick which indicators they're going to get measured on. It gets highly technical and complex. So I think it's a mixed message early on that we really don't know what they're going to do until they do it. Yeah. But I think if there's one enduring theme that I think is going to have a major, major impact on every provider in this country, it is that you're going to be confronting consumers who are going to be paying more out of their own pockets. And that's going to be a major determinant of what healthcare gets delivered in this country.
Okay. That's probably a cue to Dan, just to talk a little bit about your big picture views, which I was going to wait to do that later. But do you agree with that?
Absolutely.
And so what do you want to see happen, and what do you think is actually going to happen?
So part of the challenge that we've got, and I go into the book, I go into this in great detail, but part of the challenge is simply that we've got this tiered network of delivery that's rotating on a somewhat annual basis. And then we also have a tiered coverage system that rotates based on employment, based on age, based on heritage, Indian healthcare services. So we have these tiered models of coverage trying to align with tiered networks, and the two are rotating continually. There's no way to ever get those two to match. And what we've seen through every other industrialized country is a system of universal health coverage, which isn't necessarily single payer, but it's the universal health coverage aspect that creates the economic incentive that is, in effect, the largest actuarial pool. That's what you want in healthcare, is the largest actuarial pool. We've been fighting that math for decades, and we continue to fight it. And I come back to the quote that is often ascribed to Winston Churchill, although he never said it. It turns out it was an Israeli politician by the name of Abba Eban, who said Americans can always be counted on to do the right thing after they've tried everything else. And that's what we continue to do, is we're trying everything else, and I think we'll see with this new administration, in some ways, an attempt to try more things, and some of those will be a reversion to older methods that we'd already tried in years past, and some may actually be new methods. But until we get to some of these systemic flaws, we're not going to see the kind of progress that I think we hope for.
Okay, cool. Brian, I want to go back to you, and we've got so many issues on the table and so little time. I'm just going to go back to something that, again, came up with Franz, and that's this idea that radiologists have the potential to become this sort of uber data analyst of healthcare. What do you think of that idea?
Well, I think you need to be careful using the word Uber and radiologist in the same sentence.
Okay, that was a flip of the tongue.
That's the nightmare scenario.
You mean that they would be in India or the Caribbean or what?
You know, radiologists get Uberized.
Right. Well, that's not what I meant. But go ahead and talk about that if that's what you have to do.
I think that the potential, the other potential, we have this artificial intelligence that's coming up.
Right.
And a lot of radiologists are worried that, well, is this going to take my job away? And I think that most people, the vast majority of people that you talk to here at RSNA don't believe that. I think that what they believe is that artificial intelligence, deep learning, is going to take a lot of the more mundane work off the plates of radiologists, enable them to focus more on higher level things that deliver more value to patients.
But would that include analyzing genomic data alongside?
Of course. And these tools are going to be bringing these people
going to be wanting to do that and capable of doing that?
Well, they're going to have to. I mean, I think that one of the imperatives of surviving technological change is the willingness to adapt. And if they don't want to be looking at genomic data next to X-rays.
But do you think that radiologists are in a uniquely good position in the medical structure?
I definitely think they are, because
that's
radiology,
a good position potentially to be in.
I think it could be, and I think that a lot of times radiologists lose sight of that. I mean, this is the discipline that adopted digital technologies probably earlier than almost any other healthcare discipline. And I think that they are looking at artificial intelligence before a lot of other healthcare disciplines. So I think that they have the potential to be leaders. And in the same way that they've been leaders in digital image management, I think that they have the potential to be leaders in how a lot of these new technologies are being used to support patient care.
Meryl, yeah.
The skills of radiologists are crucial in the healthcare setting. Imaging is an important part of healthcare. And I think that in the current environment, what I hear from hospital leaders all across this country and system leaders is that they're trying to find new ways to create teams out of all of their specialties so that people are really operating together. And I think what you just referred to, which is that escalating the value that you add inside a team-based process. So if some core skills are being outsourced potentially, but somebody needs to be able to understand even that information as it comes in, interpret that for the team that you're working with. There's just a whole new set of skills that really do involve, in many ways, communication and social media, and whether it's email or plugging into the electronic health record in an active way. These are the skills that I think every physician in every specialty is going to have to learn in the years ahead. And just like radiology was on the front end in many ways of digitization of healthcare products, the image itself, I think that they should be playing a leading role in terms of helping out team-based care.
We've got very little time. Anybody have closing thoughts that they're just desperate to get out?
Just walking around here at RSNA, you really get the feeling for what an amazing discipline radiology is. And the potential, it has such great potential. I mean, they're doing so many amazing things right now. And the future is so exciting.
And I do think it's exciting in part because for many years, radiology was gated by two technologies, bandwidth and storage, that have literally been decimated. So the cost of both bandwidth and storage are such now that the field has opened up in new ways that make it, I think, incredibly exciting.
Oh, good closing thoughts and positive. So thank you. Thank you all.
Thank you.